All right, everybody. Welcome to Ask Our Vet, brought to you by Rockwell Pets Pro. We had a little technical difficulty there. We've got some storms down where I am, and they're playing havoc with my internet. So hopefully we can make it through the program here. We are talking about allergies this week. It's a timely subject this time of year, especially when all the trees are blooming and there's allergies everywhere. But we've got Mike the Voice Monkey here. We've got Dr. Max. We're ready to go. Dr. Max, how has your week been? Any interesting cases you'd like to talk about?
Yeah, week has been great. Thanks, Mike. Yeah, plenty of interesting stuff. We've seen some abused, abandoned street dogs from Mexico who've been rescued and then brought up to New York and, had bellies full of coccidia and have been treated and now having some coughing issues. We've seen that. We've seen some geriatric cats. We've seen some Westies with chronic cough. We've seen, what else have we seen today? Couple puppies with kennel cough. Kennel cough has been crazy this week. A bunch of that going on. Dog with ringworm. Shout out to one of our previous episodes. And I had, I believe it was Monday. No, it was last Thursday. It was a week ago. Yeah, I think we touched about it. Those 5 cats that had the 5-cat household.
Oh, yeah.
Ringworm.
Yeah.
So that's
left the one at home.
Right. Yeah, but it's been exciting to say the least.
Excellent. Well, anything gross or anything you want to gross anybody out with this week, or your hand feeling better? Everything is going well with
my
that?
hand is pretty much at 99 to 100%. I appreciate you asking. No craziness like that oral hematoma from last week. Just scrolling through my pictures right now. Saw a Persian cat with pretty bad breathing, but surprise, brachycephalic smush nose breeds. Yeah, not a surprise there. No colossal horrible mistakes like that cargo ship in the Suez Canal. No crazy instances of like, oh wow, this is a horrible screw up. So that's a good thing in our clinic.
You didn't have a big mastiff capsize and block the hallway at the...
No capsized mastiff and, hundreds of patients trying to get in and out and, blocked up. We didn't need to call the NYPD or FDNY to come. Thankfully, all the arteries into and out of our clinic were open. So.
Excellent. I want to let people know if they wanted to ask a question today. Last week, we actually had our first question of the whole season. You can go to the Rockwell Pets Pro page for Ask Our Vet and sign up and ask us questions. We were talking about diarrhea a while back, and my dog actually had diarrhea this week. So it was a good time. So yeah, my poor dog was just pooping everywhere and just poop was flying out. But
I'm sorry to hear that.
That's okay. She's better now. She's just an old dog. Got into something and but now she's doing better, so we're happy. We're certainly happy about that. So she is a golden, and goldens are known for having allergies, which is our topic for this week. I guess we'll start off. We'll go ahead and dive into it.
Let's do it. And that's Lily. Hello.
All right, there we go. Can you hear
me?
Hear me okay?
I hear you okay. Yeah.
Yeah, it keeps going out on me. So every time there's a lightning strike, the internet goes, ah. So let's get you talking. So let's talk about allergies. What are the types of allergies we see in dogs?
Yeah, I mean, you can get an immune reaction from anything really, but I would say the three biggest ones that I'm looking out for in dogs are food allergy, flea allergy, and environmental seasonal, like atopic allergies, atopic dermatitis. Those are kind of if we had to categorize it into a big 3, those are the ones that we're thinking about. Environment, food, and fleas.
Okay. I guess I can back up here. What exactly is an allergy? People talk about, oh, I've got allergies. I've got snotty, sneezy nose, or, my kid's allergic to peanuts or something like that. So what is an allergy?
Yeah, I mean, I guess we can define it as an excessive immune reaction, an individual, organism's reaction with its immune system to some particular antigen, something that is usually harmless. And that may be from something as small as a dust mite or a pollen from any plant or dander from dogs and cats. We have them, our pets have them. We may have them to our pets. And that's typically, it's kind of our own immune system kind of overreacting to stuff.
Okay. What are some of the symptoms that you can look out for to see if your pet has allergies?
Much in the way that we see, in ourselves, you can see sneezing, the eye boogers, a bunch of discharge from the eyes, redness, scratching, itchiness. It could be focal, meaning like kind of localized to one particular area of the body. It can be like diffuse and kind of multifocal all around, generalized on the skin. So redness, itchiness, scratching. We had the ear infection talk. Did we have the ear infection talk? I felt like we talked.
I think it was last week. Yeah,
last week or the week before. I'm forgetting pancreatitis versus ear infection, but basically,
oh, that's right. Yeah,
we spoke about like ear infections and how oftentimes it may be a result of an underlying allergy, and that's definitely a symptom to be looking out for. So it could be licking the paws, licking the legs, the belly, the inguinal region. It could really be just about anything. But yeah, I mean, those are kind of the things that you're looking for. So a bunch of scratching, maybe even scratching to the point that, could lead to self-trauma and excoriations and bleeding, if it's that bad. I remember in our vet school class on dermatology, our professor, I love him, Dr. Ferrer. He was an awesome guy from Barcelona. And he was talking about, he's practiced in the US and in Spain. And one of the first things that he put on the board was pruritus. And that's actually not a word that I had encountered before vet school, but it's kind of like itchiness, like the medical jargon. And, he says 95% of people spell it incorrectly. It's not like pancreatitis with the I at the end. It's Pruritus. And that's kind of just been ingrained in my head. But I remember him showing us a video of a cat with severe environmental allergies. And this thing was like, oh my God, I think it was on YouTube or something. It was really sad to see. It looked like it was seizing, actually. It wasn't seizing. It was so pruritic and itchy that it was like writhing on the floor, like going in a ball, like scratching stuff like a tumbleweed in a Western. And he told us that like on a scale of, pain intensity, we're thinking about, I'm never going to be able to experience what I'm grateful to not be able to experience childbirth, but the pain of that, or the pain of acute, like a ligamentous tear, which unfortunately I have felt, things that are really, truly severe pain triggers. He says, or made a argument that like the worst possible form of pruritus is, up there, or maybe even tops the most severe pain that, an individual can go through. And I just remember seeing this cat and feeling so badly for it. And then later on, actually in vet school, I think it was maybe the next semester or something, I had contact dermatitis from God knows what. I think it was from my cousin's hat. I was in Maine, in Brunswick, visiting them for Thanksgiving, and I found in the back of the truck like this trucker hat, and I was just like being funny. I put on the trucker hat, And later in the day, I like at my temple region here, I started to feel like these like bumps and hives, and I was like, oh no, this is not good. I'll take a Benadryl, see if antihistamine may knock it out and help. It knocked me out, but it did. I went to bed for the next day. I took a nap for 5 hours, but it got worse. And I just remember it spread down my face to my like clavicles, and then to my like bicep and my arms, and then all the way down to my thighs.
Oh my
And
gosh.
it was like that for about a week and a half.
Oh.
And I think on day 2 or 3 is when I can't live like this. I'm in extreme. I just couldn't be comfortable at all. I remember crying myself to sleep. I feel badly taking all the time to talk about it, but the point is that like it was one of the most uncomfortable experiences of my life, and I had 2 ACL tears, and I like put the water, taking a shower, I put on the hottest, that I could, just to like burn it. And that was the only thing that could give me some comfort. And, after 2 weeks of pred, it finally calmed down, but it was horrible. And
that's what you get for wearing a trucker hat.
Yeah. So I'm never going to have a trucker hat again. I learned my lesson. I'm not pilling cats anymore at work, and I'm no longer wearing trucker hats.
You need the pill popper, the little syringe thing.
The pill popper, wow. Exactly.
Those are awesome. Yeah, so we were talking about, the poor dogs are itching and their cats are scratching, and I'm glad you've had, I'm not glad you had this experience, but I'm glad you had this experience in the sense that now you can relate a little bit to your patients and know what they're going through.
I can empathize with them now. It's not fun.
Way back when I was dating my wife, and we didn't have kids yet. We may have been married, I can't remember. But we just decided back when you didn't have kids and you could just say, let's go to the beach. And we left at 8:00 at night to drive to Hilton Head Island in South Carolina. And we got there 1 a.m. We didn't bring anything with us. It was like no towels, no sunscreen. And the next day we spent all day just laying in the sun with no sunscreen, like a couple of idiots. And I got burned so badly. It was the worst sunburn I have had up to that point and ever had. And it was kind of right on my chest, right below my sternum kind of area.
Yeah.
And it was like exposing a cave mouse to the sunshine for the first time. Just burst into flames. And nothing would make it better. And it was one of those things where I kind of had to just suffer with it. And we put aloe on it. We put everything we could think of, and everything burned when you put it on there.
Yeah.
My skin was just like a 3rd-degree burn almost. And the only thing that worked was Neosporin lidocaine, which works, but it's also greasy. So all my shirts had a little grease spot, like right where it was.
Right.
And it eventually peeled. It got hard. The skin was hard.
Yeah.
And it just eventually peeled, and I eventually got better. But I learned my lesson at that point. So I can definitely relate to these poor dogs and cats that they just want to get at themselves. And the more they scratch, it feels better, but it still itches. And it's just, you're just scratching and scratching and scratching until you scratch yourself up, you get infections, and that can lead to a whole nother host of issues. Want to let people know they can go to the Rockwell Pets Pro page for Ask Our Vet. Sign up there. You can ask us questions. I think you can ask us questions on Facebook, and they'll pop up on my little window here, and we'll stop the show and answer your questions. It doesn't have to be allergy related. It can certainly be anything veterinary related. We'll be happy to answer it, or Dr. Max will be happy to answer it, and I'll be happy to pontificate about whatever else is going on. So, with allergies, obviously this time of the year is a little worse for allergies, or is there a time of the year with pets these days, more pets living inside, more pets not necessarily being affected as much with the seasons as we are? Is there a time of year that's worse for allergies?
Yeah, I mean, I would say when things are in bloom, springtime is when we see, I would say, more cases. But most definitely, there's a plethora of patients who, have allergies throughout the year. And, it's not necessarily seasonal dependent. And then they require kind of the heavy hitting treatments that I'm sure we'll get to later in the talk.
Absolutely. Absolutely. So go over again you said there were 3 types of allergies. Go over that again for people who are watching now.
Food allergy,
Mm-hmm.
flea allergy, and environmental allergies.
So let's start with food allergies. We talked. Do they have the same kind of symptoms as environmental or flea allergy? Do they go through the whole itchy process, or pretty much, I guess, all 3 of those? So, could you tell the
Yeah.
difference?
I mean, you can't necessarily tell the difference just based on the physical exam alone, but you can definitely have, important generalizations that can be made and indicators that might prompt you in one direction over another. Typically with flea allergies, it's usually the caudal dorsum, so kind of the lower back region is where you'll see dogs kind of like nibbling on the back. And if you take a flea comb and look through there, you may not actually see any live fleas. Oftentimes you can. If there's a big infestation and burden, you may find some flea dirt, their fecal matter that kind of collects in that comb. But oftentimes if you see little patches of hair loss or, little nibblings from where they bit into the skin, and the owner may report that's the primary area, that kind of, my ears go up like, that's my radar. Like, definitely thinking fleas, especially if they're not on a preventative for ectoparasites, NexGard, Brevecto, Simparica, there's like millions of those on the market, or Seresto collar or something like that, Frontline. I can go on and on. If they're not on one of those things, I'm like, we have to control for that, whether that's the cause of the symptoms or not, like that, because it is so universal and common in dogs. That's, the biggest thing that I'd be looking to rule out. For food allergies, those are more diverse and a little bit harder to pinpoint. Usually you're going to have some sort of gastrointestinal upset. You often have diarrhea. So that's like one of the biggest, you have to go through the whole history taking and speaking with the owner, like the owner today that brought me his dog, and, word traveled, sometimes, I'm in the exam room doing a callback or, doing something in the exam room waiting for my next patient. And I hear through the grapevine, transmission from the technician to the receptionist to whomever, oh, the dog has ringworm. And I'm just thinking in the back of my head, how, who diagnosed it? Like, did the owner think, oh, Google something or, show a picture to the family member, someone, and that someone is like, oh, that is ringworm, go to the vet. And so, like, I wasn't sure in this case, like, I was kind of doubtful that this dog, had ringworm. And I'm like, who said that? What is it? It's not here for ringworm. It's here for some sort of lesion that the owner identified. So what is that thing? And then it turns out when we took a look at it and shined on the woods lamp, I kind of concur. But so when someone comes in and, they'll tell me, oh, my dog has allergies, I'm like, it's great. Like, you might very well be right, but also, we need to kind of go through the laundry list of questions that can kind of help us identify maybe which allergy it is, or if that is even the case. So, with food allergy, the first thing that I'll be asking, even more so before I look for skin issues, is if there's been any, vomiting or diarrhea, because that's one of the big things that you'll see. And then also, in that case, the lesions, the itchiness, the redness, and potential hot for hives could be manifest kind of diffusely throughout the body, not localized to one, the back or something. So that's kind of what I'd be looking for with food allergy. And like atopic dermatitis is it's one of those like diagnoses of exclusion. You kind of have to rule out a bunch of other causes before you can really say definitively that that's what a dog is suffering from. So control for the parasites. Get a dog on a hypoallergenic dog food. Kind of go through all that stuff before starting treatment and or doing these very expensive blood tests that can tell you either blood tests or like intradermal skin tests through a board certified dermatologist, in which kind of like maybe some people I'm watching right now have gotten that when they were younger. I did, I got a little allergy test when I was like 6 or 7, I think. And I just remember like there was a small little area on my back, and then they introduced like one by one different antigens. And then, I was told that I had an allergy to Bermuda and ryegrass. And that's what I've lived with the rest of my life. I'm like, oh, I should avoid that. I don't even know what those grasses look like, but basically that's what I have. But that's kind of when they introduce those micro doses into, a small specific area. Usually they'll do it on the dog's kind of chest. But that's kind of what you do, the blood test or that intradermal skin test, to kind of look for some of those environmental allergies.
What are some of the questions you would ask somebody if they come in with their breed, whether it's a cat or a dog, people to investigate?
If you can ask the question one more time, just because you're kind of going in and out there. I'm sorry.
Okay. What are some of the questions you ask? Here we go.
I'm going to try to reiterate that.
Can you hear me now?
You nod. Oh, I hear you good now.
Okay. What are some of the questions you would ask an owner to determine about allergies?
Yeah. So chronicity, how long it's been going on, what particular parts of the body have been affected, what are the symptoms that they're noticing, scratching, biting, licking, if they've changed anything in the dog's lifestyle, if they've traveled, any recent travel history, if they've changed his or her food, and potentially what prompted the change. If a dog's doing great on a particular diet and then all of a sudden they switch, and then that's when problems start. I'm often inquisitive as to what led to that change, and I get a variety of answers. But yeah, so kind of like what's changed in the dog's environment and what the dog's been eating.
Mm-hmm.
If the dog's been around other dogs, some of those common questions are what I'd be asking. How long it's been going on.
And how do you determine, like in terms of testing, we talked about the blood test, which is kind of the extreme far end of it, but how do you go about testing and but is it just the questions, or do you actually do any physical testing?
So history is the big, a thorough history taking is one of the best things that we can do as diagnosticians. And, try to, sometimes the owners don't have answers, and that's okay. But we try to, collect as much info as we can. As far as other things that we can do to determine allergies, there are a variety of things. So, kind of ruling out other causes like infection, mites,
fleas.
So, other fleas, things that really can cause itchiness that aren't allergies. So, so skin scrapings, skin culture. If you're looking at a dog who's scratching his or her ears, the the swab and ear cytology is a big one. But yeah, those are kind of things that that you can look at. You know, and once again, it doesn't hurt to have you know, blood work and or urinalysis as well. Like, not that it's directly related, but you know that there's a number of endocrine diseases that have some skin manifestations, like Cushing's disease or hypothyroidism. Doesn't necessarily lead to itchiness, but you do have skin loss, so you get alopecia or calcinosis cutis and some lichenification of the skin, and you know, hair loss, and you know, that frightens an owner. Oftentimes there may be some systemic signs other than that, but you know, an owner can potentially confuse that for allergy potentially. So those are kind of things to do. But I would say like the external things would be like the aforementioned, you know, skin related stuff. And you know, I wouldn't jump to doing the blood test or recommending referral to a dermatologist. But those are most definitely things that you can do as well. And yeah, those are kind of the things that I think about in terms of diagnostics.
Interesting how when I first started in this business forever ago, we had so many dogs with fleas. Fleas was just, it was fleas. And you had the flea dips, the places, the pet stores that would have the free flea dips on the weekends. You take your dog and you put them in a big galvanized steel tub. They dump stuff on them, and then, you know, they run around the parking lot. It's to the point now, the preventatives are so good now that we get surprised when we saw fleas on a pet. You know, it used to be just a common thing. Oh, there's a flea, pick it off, pop it with your fingernail on the table, and then move on. We'd have dogs we would bathe, and it looked like they're bleeding from all the flea and the flea dirt and
they probably were.
The flea poop and everything. It was horrible. But we don't see that as much now. And it's still, owners still come in and go, my dog's itching, he has fleas. And it's funny how fleas have gone so far down the list in terms of what could be on your dog. And yet people still come in and go, it's fleas. You're like, well, no, it could be allergies. It could be something. And they go, no, he has fleas. You're like, well, you know, he's on Advantage. He's on, you know, whatever is around at this point. So, so in terms of what are some of the more common things pets are allergic to that you found besides fleas?
Yeah, I mean, there's numerous plant species, fungal species, storage mites, dust mites, cats, and you know, plants, you know, different species of grass or tree, and I'm forgetting exactly the specific genera or species that are on the HESCA allergy panel that I've ordered for maybe 7 patients in my career practicing. I don't do it so often, as I mentioned, just because it is very expensive. And, you know, at the end of the day, some owners don't even care about what the dogs are allergic to. I mean, it's not that they don't care, but they're more about, let's just treat the dog and let's make sure that his or her quality of life is manageable and tolerable, because it can quickly go from tolerable to intolerable. And so they, you know, have no interest in doing testing. But yeah, those are the things that have come back on those panels. So oftentimes, you know, it can be speculative, like, you know, we went to the park, we went hiking, we don't know what shrubs or whatever were there, like, you know, if they went upstate New York or something, but, you know, he got this reaction. Sometimes it could be an acute thing, where, you know, it's kind of this like anaphylactic. I mean, in those situations, you know, oftentimes they'll go to like an emergency hospital closer. But we've had some cases of anaphylaxis, and it could be from a vaccine. I haven't even mentioned that, but, you know, sometimes the things that we introduce into our patients, while well-intentioned and very good from like public health and individual standpoint of prevention of disease transmission, can actually have a really negative effect on them. And, we document that, we'll call the manufacturer. We will either pre-medicate next time or, make allowances to not vaccinate a particular individual with a particular vaccine based on the reaction. I just remember like a pug came in when I was working in Massachusetts. Her name was Dora, and she was like this cute, fat little pug. And I think one of the doctors gave her a Lyme vaccine.
Pug. We can do the fat math. It's fine.
Yeah. And like she gave her the Lyme vaccine, and like she almost died. I mean, she was like not able to breathe, and thank God for some quick acting injections and steroids and antihistamines. Benadryl and dexamethasone did the trick. But it was scary.
Speaking of pugs, are there certain breeds of dogs or cats that are more susceptible to allergies than others?
There probably have been studies as to, maybe breed predispositions, but I've seen it in everything. Yeah.
We always would have
bulldogs. You get an English bulldog with allergies, surprise, surprise. I would say, if I had to, I would say those.
We'd always see my poor Golden would have allergies, bulldogs, pugs, Westies, things like that. And do you see it in more dogs that are more, this matters, low to the ground? Their nose is in the grass. Their nose is, just in that bush, sniffing them.
Yeah, for sure. I mean, I think it's probably a combination of the conformation of the body and like closeness to different, plants and stuff that, could trigger reactions. So that's probably definitely a part of it. And then also a dog's, I guess, in persistence at like exploring different areas, and maybe one who's a little bit closer to owner and not wanting to stray off the leash so much, maybe not getting themselves into the thicket, and that's possible. But it's also possible that they're, staying indoors and, not really going out much, and yet still have symptoms. And that's possible too. And it could be from, what the owner brings in on his or her clothing. And those cases are really difficult because, exposure or.
There we go.
Can you hear me?
Oh, yeah, it cut out.
Yeah. Because you're not sure, like, what is this dog exposed to that this is happening? If they're like, indoor only. And I have some dogs who are like litter box trained and like don't really go out because their owners, stay and keep them in the house. That's what they do. Their prerogative, but why are they getting allergies? So those are kind of the head scratchers. But but I think you're right. Probably those that are lower to the ground and more keen on exploring probably get it more.
What about cats? Do you see cats? You got an indoor cat versus an outdoor cat? Do you see more allergies in the indoor cat, or is the outdoor cat kind of? My mom's cat had a lot of itchiness, and she did the allergy testing with her cat, and it turned out he was allergic to cockroaches, I think, which is like, all right, random. But somebody's like, get the cockroaches out of the house, I guess. But we talk a lot on the show about dogs. We don't, necessarily do a lot about cats, and I know we've got a lot of cat viewers out there. Sure. Anything different with cats as opposed to dogs?
I'll be honest, I don't see it as often in cats, or maybe it goes undiagnosed more, and owners aren't, seeing that as much. But yeah, I mean, I guess in terms of environmental allergies, just because I'm dealing with so far fewer cats who are going outdoors. But food allergies, most definitely. I think much like in dogs, you're thinking about chicken and beef as being the primary or the most common food allergens. And so, yeah, I mean, there's actually two kittens right now that, they've gone through a laundry list of different diets, and I'm suspicious of food allergy. And so right now they're on a novel protein. Right now they're on salmon-based diet and doing better on it. So we're probably going to keep them on that. But yeah, so I mean, I've seen definitely food allergy more in cats and fleas. Those are the things that I'm seeing causing scratching and itchiness in cats. I feel like I get dogs presenting to me for itchiness way more than I get cats.
Okay. Can a dog be allergic to its own dander?
Yeah, it's a great question. I suppose it's true, and if that's the case, I'm sure it's extremely rare. But I guess I don't want to say no, because this is science, and really, like, anything is possible. I'm not familiar with a particular case, or I've studied one, but it could be possible.
So how do you treat dogs with allergies? What do you like to do?
So, yeah, I mean, I like to start small and then go big, depending on severity. So, a dog might come in with excessive tearing or sneezing, not much in the way of any no visible skin lesions. And for those, save, for, we'll get to the more heavy hitters, but, I'll just tell owners about like over the counter stuff, or, home remedies. I know that, one of those questions was like kind of stuff at home that you can do. Omega-3 fatty acids, fish oil supplement. That's a great one. I think the brand name, or one of the things that we have in our clinic, is called Snip Tips. So those are good options for dogs and cats who have itchiness, or, it also helps kind of with the hair coat and kind of getting that nice sheen look. Those are good options. Over the counter antihistamines are something that I often tell owners about, and then they're like, "Oh, wow, I didn't realize that I could give my dog Zyrtec or Claritin," and I'm like, "You can."
Yeah.
And so that's something that can be done.
What dose do you normally give them? Of like Zyrtec or something? What do you tell people?
It depends on like the size of the dog, but like 5 or 10 milligrams.
Okay.
Yeah.
So how else do you treat them? Sorry, go ahead.
Yeah. So antihistamines. If you're dealing with food allergy, obviously diet change to a novel protein diet or hydrolyzed protein diet, and then doing that for 8 to 12 weeks, and then re-challenging with the original diet. And then if you get a bad response, skin breaks out, diarrhea, you immediately put them back on the new one, and that's what you feed them for the rest of their life. So those are ones that I think about for food allergy. And say you have a dog who's not responding to any of these changes, then you start broaching the topic of Apoquel or Cytopoint. And those are, for listeners who may or may not be familiar, it's a medication. One others like a monoclonal antibody injection. The injection being like once a month or once every 2 months. So it's not solving the problem. It's going to be treating the symptoms, and it really has a pretty high efficacy in treating pruritus. I found in my patients that it works really well, and really no side effects. Or it's, it either works or it doesn't, kind of thing. But it really targets like the cytokines, and helps dogs feel better. So for dogs who have really just intractable itch, I will give them that, whether I even have a diagnosis established or not. I think that it can be really beneficial for them. And it's something that you don't need to give orally, just a quick injection in the hospital. So I like that a lot. Apoquel is one of those things where it's more chronic usage, or it's given once. You start off like twice daily dosage and then once daily kind of after a 2-week period. You kind of do have to monitor blood work every couple months, maybe every 6 months, for like liver value elevations. But that's also kind of an option for owners to do like at home allergy pills.
My wife's dog is on that,
cool.
Apoquel, and I laugh at her because she always, and I can only do this to her, but she called it Apoquel. And I'm like, no, it's Apoquel. She's like, no, it's Apoquel. I'm like, no. We have to laugh about that. It's a good time when she mispronounces veterinary stuff.
I honestly love when people come in and call things. Yeah, I love it because, so many things have multi-syllables, and it's just like, wow, if you're not a vet or you're not like in the industry, it's going to be really difficult. Like, I'm not expecting my mom to know this stuff, and it's just a lot of syllables. And so like,
right.
Oh, one of them was like instead of trifexis, someone said triflexis, and it's like, oh, you get a new car, and stuff like that. But yeah, I mean, I say Apoquel, you say Apoquel, she says Apoquel, whatever it is, it's definitely a good thing for our patients.
It's one of those things that once you hear somebody say it, you go, oh, right. Like, I do some medical narration, right. And when there are certain words that are, you're like, but, they're like, no, it's this. You go, oh, that's right. Yeah, I forgot it. It just, it's not a thermometer, it's a thermometer. So yeah, you just kind of have to go from there. So
one of my professors said apoptosis and not apoptosis, which we always thought was funny. Yeah, but those are things that can be done. And steroids, steroids are a beautiful drug class that can really target itch well. They also have their fair share of side effects that I always talk to owners about before prescribing. But definitely, prednisone or prednisolone for cats can be something very good for them. But yeah, I mean, it kind of depends on severity and previous history. Some owners, they're going to hear that their dog has these bad environmental allergies after ruling out other causes. They're going to be given a month-long course of Apoquel, and they take it home with them. The dog does great, and then you lose them to follow-up, and they take the dog off of it, and then soon thereafter she's going to be back itching. And so like it's one of those things where it's like, oh, I'm sorry, honey, you don't take your dog off of it. It's good that the past 3 days have been helpful, but you don't take it off because the dog's no longer symptomatic. Like, it's actually potentially going to be requiring this long-term or indefinitely, unless you move somewhere where whatever the offending allergen is not going to be a problem. But that's something that, you kind of have to stress to owners, because, I get it. Like, it can actually be very expensive, to treat dogs with allergies, and not so rewarding when you don't even necessarily know what you're treating. If it is like atopic dermatitis, which oftentimes is most likely the case, and you don't actually know what it is, because you don't, the owner doesn't want to do the tests, and I understand that. And so you're just trying to really keep the dog comfortable. And at the end of the day, like, I'm of that mindset too. Like, I want to do something that's best for my patient's quality of life, even if I don't exactly know what they have. So, that's what I do for them. I try to make them as comfortable as possible while reducing potential side effects and trying to figure out what's the best thing. Are we going to do the Epiquel indefinitely and Cytopoint every month, every 2 months, kind of depending on when a dog's itchiness may recur? And those are very individualistic things. There's no one right way to tackle this, unfortunately. It's very patient specific.
Right. And there's so many different things they could be allergic to. You're almost like, let's try this and see if it works. And then if it works, you just kind of go with it. What percentage of people actually go through with the allergy testing? And what's involved in allergy testing?
Yeah, so I'm not sure what the statistics are, for everyone, but for me at least, like, I've only, I think, had 7 patients who have done the HESCA allergy test that we, get a blood sample, send the serum to Colorado, laboratory in Colorado. 3 weeks later, they send back the results. That's kind of what's involved with that. And then the other far less chosen route would be, if I refer a dog to a dermatologist, he or she will do the, intradermal skin test, and potentially do like allergen specific immunotherapy, which could be shots or like oral, like lingual medication. But a very, very small percentage of owners end up going down that route.
All right. Let's see. So we'll go through that. Is there any way they can prevent allergies?
I don't really know.
I mean, a lot of times you don't know you have them until you start having them. So
yeah, I mean, avoid, keep your dog locked up in a vault 24/7, and don't feed him or her anything, because that food could potentially be an allergen. So don't feed it anything, don't give it anything, don't look at it, keep it. No, I'm just kidding. For those listening, this is not medical
hermetically
advice.
sealed room. Yeah, that's right. Yeah.
No, I mean, it's we can't all live in a bubble, but I'm not necessarily sure. We can prevent, symptoms, not necessarily prevent, but reduce likelihood if, we have diagnosed history of it and known positive response to, various medications or, some of those home remedies. But yeah, I mean, it's one of those things that, if you have it, can't really get rid of it necessarily.
So this is not something you necessarily cure. You just kind of have to live with it.
Yep. Avoid it, live with it, reduce the symptoms of it. There was a vet, so this is a human with an allergy, but a vet, I think she was a resident when I was a rotating student, and she had, I think she was allergic to cats. And I just know that she took shots every day to do her job as a vet. And I'm like, wow, that really is incredible. I don't know if I could do that to myself.
No, but it's like being diabetic. You give yourself insulin shot.
I mean, but she didn't have to choose a profession that required her to be around cats every day. But
that's true.
Yeah, but yeah, no, for sure. I'm
exactly. So, I will let people know they can go to rockwellpetspro.com and use the, oh no, my thing went away. Use the, I had the sheet and I lost it.
The code.
I believe the code is allergy. I believe they could get some of the bone broth with turmeric, $10 off that at rockwellpetspro.com. My page cut that off. Is there any other things you want to talk about with allergies? Any other tips and tricks you want to give people? Just be on the lookout for. I mean, you got the Benadryl you can give from the store. Go see your vet, obviously, but
I mean, definitely I recommend go see your vet and just, and an appreciation, I acknowledge that a dog itching him or herself doesn't mean that he or she has allergies. It could be like a focal scratch. Maybe they rubbed up against something and been laying down. They just have an itch. Doesn't mean they have allergies. But what I would be strongly recommending to owners who I'm sure, love their dogs and want what's best for them. I see owners walking down the street, their dogs who are kind of limping behind, and they don't notice their dog's back leg is limping, for whatever reason. It's patellar luxation or maybe a cruciate ligaments pulling or who knows, but they're kind of pulling the dog. They just aren't aware of it. And I see that and my heart breaks. So I guess my final bit of advice would be like, if you're suspicious that your dog might have allergies or has been scratching a lot at his ears or really any part of his body more than what's considered normal, or you see redness or you see really anything that's out of the normal, benefit of the doubt, give it to your dog and give them the gift of, going to see the vet, because, it's painful and it's, being itchy is not a good feeling. So that's what I would like to leave my note on.
Okay, so I got my sheet back here. So natural dog bone broth with turmeric. I was right. Get $10 off with the code Allergy, and not Allergies, but Allergy at rockwellpetspro.com. Well, it's been an interesting show with the internet issues. I'm going to be on the phone with my internet company tomorrow, trying to get this thing worked out. Okay. So Comcast.
Good luck with everything, right?
But we'll be back next week, same time, 7 p.m. Thursday night, live here online with Rockwell Pets Pro and Dr. Max and Ask Our Vet. Dr. Max, you have a great week, and we will see you next week.
All right, you take care. Bye-bye.